The streets of Ekpoma in Edo State witnessed another powerful demonstration of public frustration today as the security crisis gripping the university town continues to escalate and now threatens the entire state's healthcare system. While youths and residents had previously taken to the roads demanding urgent action against rising kidnappings around the Ambrose Ali University community, the situation has now reached a critical breaking point, with doctors across Edo State withdrawing all medical services as of 8 a.m. this morning, Saturday, January 10, 2026, leaving hospitals without physicians and patients without access to critical health care. The medical professionals' decision to suspend services statewide comes after two separate kidnapping incidents that have sent shockwaves through the healthcare community and exposed the vulnerability of those who serve the public. On January 1, Dr. Abu Ibrahim Babatunde, who works at Edo State University Teaching Hospital in Auchi, was kidnapped along with his younger brother Abu Tahir, a fresh medical graduate from Ambrose Ali University. The two brothers were abducted by gunmen at the gate of their residence along City Pride Road in the Igbira camp area of Auchi around 7:30 in the evening as they returned from work. Then, on January 2, another physician named Dr. Stephen Osamaye, who works at Irua Specialist Teaching Hospital, was kidnapped along Ile Road in Ekpoma, creating a pattern that suggests medical professionals are being specifically targeted by criminal gangs operating across the state. What makes the Babatunde case particularly heartbreaking and has galvanized the medical community into this unprecedented action is that the kidnappers murdered Abu Tahir despite ongoing ransom negotiations with his family. The body of the young doctor, who had just completed his medical training and was about to begin what should have been a fulfilling career serving his community, was discovered near a riverbank, leaving his family devastated and the entire medical profession in shock. The kidnappers had initially demanded 200 million naira for the release of both brothers, but after killing the younger brother, they continue to hold Dr. Abu Ibrahim Babatunde in captivity and are now demanding 100 million naira for his release. The family has been forced to launch public appeals for financial assistance because they simply cannot raise such an enormous sum on their own. Dr. Eustace Osegale, the chairman of the Nigeria Medical Association Edo State branch, announced the withdrawal of medical services in a statement issued on Friday, describing the action as a direct consequence of the abduction of their colleagues and a reflection of the heightened sense of vulnerability among medical practitioners throughout the state. The association is demanding the immediate release of the kidnapped doctors, enhanced security protocols for all Edo State residents, and regular engagement between the medical association and the state government on security concerns. Dr. Segale made it clear that doctors would continue to withhold services statewide until their demands are met and their colleagues are safely released, emphasizing that a safe working environment is not a luxury but a fundamental requirement for healthcare providers who are being asked to serve their communities. If you are finding this coverage helpful and want to stay updated on this developing situation that affects millions of people in Edo State, please hit that like button, share this video with your family and friends, and subscribe to Global View so you never miss critical updates like this. The decision by doctors to withdraw services means that right now, hospitals across Edo State are operating without physicians, leaving only emergency cases being attended to and putting countless patients at serious risk. Any patient requiring medical consultation, treatment for chronic conditions, surgical procedures, or routine health care is essentially without access to doctors, and this situation will continue until the state government and security agencies can address the demands of the medical community. Earlier in the week, doctors in the Edo North Senatorial District organized a protest march through Auchi and surrounding areas, visiting the palace of the Otaru of Auchi, the Edo University Teaching Hospital, Edo University at Iyamho, and the Police Area Command in Auchi to express their deep concern over the worsening security situation. Dr. Ifije Patrick, the NMA chairman in that zone, stated that their demands are simple: secure the release of the kidnapped doctor, stop the killings, and make Edo North safe for everyone. He warned that if their demands were not met within 72 hours, doctors across the entire state would embark on a total shutdown of medical services, describing it as a last resort to compel government to take decisive action. That deadline has now passed, and the threatened action has become reality. The protests that occurred earlier in Ekpoma specifically highlighted recent abductions that have terrorized the university community, including the kidnapping of a student identified as Akabe Favor and an unnamed former student union leader of Ambrose Ali University. Protest leader Andrew Oziegbe addressed journalists during those demonstrations, making it clear that students and residents are living in fear and that the response from relevant authorities to these security challenges has been completely inadequate. Oziegbe warned that continued silence and inaction from government authorities could further endanger students and residents, emphasizing that the peaceful protest was aimed at compelling security agencies to take decisive steps to restore safety in Ekpoma. In an interesting development that reveals the complex dynamics at play, the management of Ambrose Ali University quickly moved to distance the institution from those earlier protests. University spokesperson Otumba Mike Adealadenika issued a statement claiming that the individuals involved in the demonstration were not registered students of the university, were not members of the student union government, and had no affiliation with the institution in any capacity. The university management condemned what they described as attempts to disrupt the peaceful academic environment, essentially declaring the protest null and void. However, this institutional denial sits uncomfortably alongside the undeniable reality that kidnapping has become a persistent threat in and around the university community, affecting students, graduates, and healthcare workers alike. Governor Monday Okpepelo of Edo State has acknowledged the severity of the crisis, describing the existential threat of kidnapping as a worrisome issue that has taken more than the devoted attention of his government. The governor pointed to bush-combing operations carried out by security forces across Ochi, Agenebode, Opela, Fuga, and Owan areas before the holiday season, claiming that several kidnappers' hideouts were destroyed and numerous arrests were made. However, the continued occurrence of high-profile kidnappings, including the abduction and murder of medical professionals, clearly demonstrates that whatever measures have been implemented so far are insufficient to address the scale and audacity of the criminal networks operating throughout the state. What makes this situation particularly alarming is the brazenness with which these criminals are operating. They are kidnapping medical doctors who provide essential life-saving services to communities. They are abducting students and young people who represent the future of the state. And they are doing all of this with apparent impunity, demanding ransoms of 100 to 200 million naira and even murdering their victims while negotiations are ongoing. The fact that a fresh medical graduate could be killed by his kidnappers, despite his family's efforts to secure his release, shows a level of cruelty and disregard for human life that demands an urgent and comprehensive security response from every level of government. Make sure you stay subscribed to this channel and turn on notifications because this is a rapidly evolving situation and will continue bringing you updates as they develop.